Idaho's system for death investigations relies on elected coroners who often lack training, education, oversight, or state support and are funded by county budgets. Failures documented by News Pulse left families without answers in deaths, potentially overlooking foul play. An Idaho Office of Performance Evaluations survey revealed deep concerns, with one coroner stating, "The coroner system in Idaho is broken and a joke." Many coroners believe the state's hands-off approach creates inconsistency between counties and want state involvement. Coroner Jimmy Roberts of Bingham County drafted a 118-page report outlining problems like lack of resources and suggesting solutions that worked in other states, such as creating a state training council, defining autopsies required by law, fee-based funding, and giving coroners first responder status. However, reform progress is uncertain despite a governor's subcommittee examining issues like an autopsy fund or a forensic center, and coroners lack consensus. Association President Tori Danner prefers focusing on simpler changes first. Here are 5 concrete steps suggested by Idaho coroners. 1. More autopsies. Idaho has among the lowest autopsy rates in the U.S. Attributed partly to cost, many counties have small autopsy budgets. An autopsy costs over $2,300, and demand can quickly exceed budgets. Without state funding support like neighboring states, coroners must choose between autopsies and budget constraints. Ada County handles most autopsies for the state, but faces capacity limits due to staff workload restrictions and high demand. Coroners proposed a state-funded forensic center in eastern Idaho, but county commissioners rejected previous attempts due to cost. 2. Higher pay. Many coroners earn very low salaries. At least 7 make below $10,000 annually, and another 12 make $10,000 to $20,000. This necessitates nearly all having other jobs, e.g., funeral home work, medics, various professions, and leads to difficulties finding deputies for coverage, hindering consistent death response. One coroner noted the impossibility of recruiting deputies or replacements due to low wages. 3. Office space. Half of the survey respondents lack county-owned office space. Working from funeral homes, other workplaces, or even their homes. Few counties have secure morgues, relying on funeral homes or hospitals. This negatively impacts confidentiality and evidence security, like maintaining the chain of custody for bodies and evidence. One coroner highlighted the inability to secure evidence and prevent unauthorized access. Specific examples include coroners working from trucks or temporary spaces for years despite requesting adequate facilities. 4. Consistency statewide. Coroners propose a standard system across Idaho. One suggested a state-run, state-funded system with a head coroner setting investigation protocols. Neighboring Montana uses a state-supported hybrid model. Currently, practices vary widely by county, while Idaho clarified which deaths must be investigated. Investigation remains undefined. Other states provide clearer definitions. Subpoena power, specific autopsy mandates, and detailed investigation standards. 5. More training. After 1 year of residency, any U.S. citizen 21 or older can become coroner in Idaho without certification. Training laws require a baseline course and recurring education but have no enforcement mechanism. News Pulse found 1 in 4 coroners repeatedly missed requirements. Coroners report feeling unprepared. One recounted signing off prematurely on a death later linked to a murder charge against the spouse. In another state, acknowledging he would act differently with more experience. While law now requires nationally recognized training, there are still no penalties for non-compliance. Other states mandate hurdles like tests for deputies or link training to salary tiers. The Evaluation Office noted coroners urging the legislature to provide stronger leadership, enforceable training standards, and sustainable funding